Hi, this is Dr. Minkoff, LifeWorks Wellness Center. On this issue of men's health, I like to do an annual screening on every man that comes in here. I do this annual screening on myself. I do it on my 2 male adult children, and I do it on anybody I can talk into it, because it looks for specific things which identify the risk factors to things which cause the most mortality, which is death, and morbidity, which is problems with the body, than anything else. So leading the list is cardiovascular disease. Unfortunately, the first symptom of someone with cardiovascular disease in their 40s or 50s or 60s is about 50% of the time sudden death. The person doesn't know they have blocked arteries. They don't even suspect it. They're not walking around with stable chest pain. They just get chest pain and die. A friend of mine this just happened to only about a month ago, 53 years old, an athlete, not overweight. I wasn't his doctor, so I don't know what his particular health problems were. He was sitting in his house at 4 o'clock in the afternoon on a Saturday. He got chest pain. The family called the ambulance. They were there within 7 minutes, and he passed away. Terrible. I saw a patient yesterday. He's been a patient of mine for a while. He lives out of town. Woke up at 2 o'clock in the morning, got chest pain, went to the hospital, got 4 bypasses on his heart. I saw him yesterday for a recheck. He's doing fine. These things are not that uncommon, okay? About 600 and plus thousand people a year die of heart disease. It's usually associated with diabetes, or can be associated with subclinical diabetes, where people don't know that they have any problem with their blood sugar. And so there's a battery of tests that can be done to just like make sure this stuff is okay. I'm going to go through a couple of these things. I want to know, what is the fasting blood sugar? What is the fasting insulin? What is it's called hemoglobin A1C? It's the average of blood sugar over the last 3 months. We want people to have an average blood sugar of below 100. Actually, below 95 would be even better. You don't know these things unless you measure them. It's also important, there is a hereditary condition where people have trouble with making active B vitamins. It's called a methylation defect, and some of you have heard about methyl defects, genetic methyl defects. One of the ways to check for this is a blood test called a homocysteine. And homocysteine is associated, if it's elevated, with heart disease and cancer and all chronic illness. This is easy enough to measure. About 35% of the population has this defective gene. It's in my family. My grandfather died of a heart attack. My father died of a heart attack. My brother has had a heart attack and 4 bypasses. I had a high homocysteine. I take a treatment, which is a certain mixture of B vitamins, and my homocysteine went from 14 or 15 down to 8 or 9. It's in normal range now, so that risk factor I don't have anymore because I've modified it. There is a lipoprotein. A lipoprotein is a protein that carries a fat. If you try to put fats in water, they layer out. The fat will come to the top. So there needs to be a way in the body to transfer fats from one place to another. And so they hook them to certain proteins and they move them around. Some people have a problem with a protein called lipoprotein small a. And that lipoprotein, if it's very elevated, can be a risk factor for cardiovascular disease. So we measure it. We can modify this. Vitamin C and fish oil and niacin, which is one of the B vitamins, they can modify this. So these are factors which are good to know, and we can do something about it. There's another lab test called high sensitivity CRP. CRP stands for C-reactive protein. An elevated C-reactive protein means there is inflammation going on in the body somewhere. Now, if you have an abscess on your elbow or you just had an operation, your CRP will go up. But many people have a high CRP when they don't have inflammation that they know of. They're not suffering from some pain or some injury or something, but their CRP is high. Now, on the lab core, Less than 3 is okay, and less than 1 is really good, so we want people as low as we can have it. I find people all the time who have CRPs of 4.5, 6, 18. They're not particularly complaining about anything, but I know that a high CRP is associated with much higher risk of cardiovascular disease, which is strokes and heart attacks, with high blood pressure, and with cancer. So if I do a screening test on someone and I see a high CRP, high sensitivity CRP, I am going to start looking for where is this inflammation coming from. We know that cardiovascular disease is a result of inflammation in the arteries. Inflammation is caused from injury, it's caused from infection, it can be caused from heavy metal deposits. But there is an injury going on, and the CRP elevates when this injury is going on or this inflammation is going on. So it's really good to test. The most common problem in elevated CRP, is either infection in the teeth. It may be deep pockets in gums with infections. It may be root canals. It may be these things called cavitations, where there's areas in the teeth where there's been a tooth pulled, but there's infection smoldering there. You might ask, wouldn't the person know about this? And the answer is usually the person doesn't know about this. It doesn't cause pain, but it causes inflammation. And we know for a fact that the bacteria that are in the root canal teeth or in the deep pockets, they get into the systemic circulation. They can get in the arteries of the heart or the small blood vessels in the brain. They can cause inflammation. They can block things off, and then you have a heart attack or a stroke. So this is really important. The other big place where you can have infection where you wouldn't know about it is in the intestine. Sometimes people have high levels of bad bacteria or parasites or funguses, and they create inflammation all over the body. So ideally, I'm getting a good dental history from the patient, and if I have any suspicion, like a high CRP, I will send them for a specialized x-ray to make sure their teeth are okay. The regular dentist is not doing the specialized x-ray. You need to go to someone who does a CAT scan, basically, of the teeth. It's a little over $300. It's well worth it if you have a high CRP. Also, we would do a stool test. Now, the stool test can tell us, do you have enough good bacteria? Do you have too many bad bacteria? Bad bacteria are basically an infection in the intestine. Sometimes an infection is in the small bowel. It's called SIBO, small intestinal bacterial overgrowth. Sometimes it's in the colon. It also tells us if there's inflammation, there's proteins that indicate inflammation. It also shows us, is the immune system in the intestine either elevated or depressed because of the infection. It also tells us, do you have enough digestive enzymes so your foods are actually getting digested? So it also looks for about a half a dozen different kinds of parasites and yeasts. So this gives us a lot of information, and as a routine annual test, it's just really important to get it. So these are things that help with cardiovascular disease. And then when we're looking, and also diabetes, because this tends to come in, or pre-diabetes, we also suggest that people get a test called a Cologuard, probably once they're over 40 years old. Cologuard can detect colon cancer with a good degree of accuracy. If the Cologuard is abnormal, we suggest people get colonoscopy, or if you have a strong family history of colon cancer, of course, get a colonoscopy. But these are things that really can make a difference. This is over an overall thing. You want to make sure you're okay. You know, you send your car in every 5,000 or 10,000 miles, whatever it is, and they have a whole checklist. Look for this, look for this, look for this. It's okay. We found this, we did this, and it was okay. Now, just this morning, I was at the motorcycle shop. I like motorcycles, and I have a 2003 BMW Cruiser motorcycle. And it was making a little bit of funny jerking, and I wasn't sure what was going on with it, and I took it in. And when the guy showed me the just about burned out fuel pump, that there was 2 belts that were supposed to be an inch wide, and they had about 1/8 of an inch left on it, it sort of hit home that the same thing goes. He says, I can't believe you were riding this thing, because the chances of you getting stuck somewhere were really high. But I didn't know. I bought this used I bought the motorcycle used. They said it had been serviced. It turns out it hadn't been serviced. It needed a new clutch, whole bunch of stuff. But for all intents and purposes, this motorcycle seemed like it was running almost fine. And the body is very similar. Unless you take it in and you get it looked at, you don't know what's going on, because it's a very complicated structure, and the ability of a man to pretend that nothing is wrong is really high. So why even go there? Once a year, come in, get this battery of tests, then you know where you're at, and if there's some intervention, whether it's dietary or supplements, which usually it is, or your levels of heavy metals. It's another one I didn't mention, but heavy metals are very common. High lead, high mercury, high arsenic, high cadmium. These things are in our environment, and we get these in. And when those things get in the blood vessels and in among the cells that line the blood vessels, they create inflammation. They can elevate CRP. They can cause blockage. So that's also part of the panel that we do. Just where are you at once a year? It does cost a little bit of money, but it will save you, one night in the emergency room with chest pain will be $15,000 or $20,000, and these tests don't even come close to that number. So I really recommend it. It's Men's Health Month. It's a good time to actually do it. Come in, get a physical exam, get the lab test done. We can then recommend a supplement program, and then you know that your chances of then in the middle of the night at 2 o'clock in the morning of having a heart attack or a stroke or of showing up with colon cancer when you least suspect it, because this disease does not present with symptoms early. You will not know it. And it's much better to find it out first, because you can actually do something about it. Like, early intervention is curative or preventative from ending up with a big problem. And so these are things which can really make a difference. Okay? So come in, get evaluated. It can make a difference, and we can help you. Okay? Have a good day.